working with your patients on crutch gait training, it is important to understand the different weight-bearing terminology. Weight-bearing is the amount of weight that can be borne on an upper or a lower extremity during functional activities. The amount of weight-bearing permitted is dependent on the patient's pathology, impairment, and medical management. There are 5 commonly used terms to describe weight-bearing for the lower extremity that we need to keep in mind when we are doing gait training activities. Non-weight-bearing. The involved lower extremity is not to be weight-bearing and is usually not permitted to touch the ground. Toe-touch weight-bearing. The patient can rest the foot of the involved lower extremity on the ground for balance, but not for weight-bearing. Partial weight-bearing. A limited amount of weight-bearing, such as 5 pounds, is permitted for the lower extremity. When a specific weight is not provided, minimal weight-bearing should be permitted on the involved lower extremity until a specific amount is confirmed by the referring physician. Weight-bearing is tolerated. The patient determines the amount of weight-bearing that will occur on the involved lower extremity. The amount of weight-bearing permitted may vary from minimal to full, depending on the tolerance of the patient. Full weight-bearing. The patient is permitted full weight-bearing on the involved lower extremity. Before gait training begins, you must first adjust the crutches to your patient's height. First, adjust the height so it is level with the greater trochanter, or even with the wrist crease with the upper extremity by the side. Secondly, observe the angle of the elbow. It should have flexion between 20 to 25 degrees. I'm going to help you learn how to use the crutches today.
Okay.
And the doctor had said not to put any weight on your leg. Is that true?
Correct.
Okay. Would you mind telling me how tall you are?
I'm 5'6".
Could you help me out? We're going to adjust these. All you have to do is push in that button. Let's put the belt on you before we practice your walking. Just to be safe, gives me something to hold on to. Okay. All right, do you remember how to stand up with these?
Both in this hand. Scoop
And now,
forward.
Yep, scoop forward first. And I'm going to be here standing on your side that you had the surgery and hold on to your belt back here. Okay. When assisting the patient to rise to stand, the patient moves towards the front of the chair seat and places the right foot approximately 6 to 8 inches forward. The hand pieces of both crutches are grasped in the right hand and are positioned vertically slightly in front and to the side of the chair. The left hand pushes off the chair. To rise, the patient leans the trunk forward and pushes with both hands and the left lower extremity. The patient establishes balance and uses the left hand to place one crutch in the left axilla. The remaining crutch is placed in the right axilla using the right hand.
Okay.
And push off with your other hand. And remember, no weight on that leg.
Okay.
1, 2, 3. Now swing that one crutch underneath one arm. Now while you're standing here, I just want to check and make sure the fit is good. So I'm going to put 2 fingers under here. That feels good there. And you want a nice bend on the elbow. That looks good. How does that feel? Pretty good? All right. So remember with the crutches first, do a surgery leg and then swing through. Good. Nice job. Okay, why don't you take little steps as you're turning. I'll go this way towards your left. Okay, and I'll put a hand up here just in case we keep you safe. All right, crutches first, leg, and swing through. Good. All right, turn around. Now back up until you feel the back of the chair on your leg. Okay, now why don't you bring both crutches over to that same side again. Put your hand inside. Now reach back to the chair and sit down nice and slowly. Nice job. All right. So now we're doing toe touch weight bearing. With toe touch weight bearing, your patient can set their foot on the ground, but they're not putting any weight, so it's mostly used for balance. So this is toe touch 3-point.
Yeah.
So even though it's called toe touch, you still want to put your heel down first. It's a mimics normal walking pattern. But again, there's no weight, it's just there for balance. So next is partial weight bearing, and this the amount of weight that your patient can put on is based on what is prescribed by the physician or the surgeon. Again, it's 3 points, so the crutches, the foot, and then swinging through. And turn around. Next one, those were all 3-point gait. Now we're going to do a modified 3-point. And sometimes patients prefer to do this because they're not quite comfortable swinging their leg through yet. So what you do is the crutches, then your foot, and then you just step to where your other foot is. Sometimes patients will do this first, and then they'll learn to do a 3-point gait. Now we're going to do what's called a 2-point gait. And with this type of gait, you have to be full weight bearing in order to do this. And it mimics the best gait pattern closest to normal walking. So the crutch goes forward with the opposite leg. Next we're going to do the 4-point gait. Again, you have to be full weight bearing for this. It can be a little more complicated for the patient, but if you verbalize how to do it, it makes it easier. So you first tell them left crutch, right foot, right crutch, left foot, left crutch, right foot, right, left, left crutch, right foot, right crutch, left foot. So we're going to practice going up and down stairs. I'm going to be on the side that you have your surgery. As you're going up the stairs, you're going to go up with your stronger leg first. As you're coming down, you're going to be coming down with your weaker leg first. Okay. All right, so you're going to put the weight down on your hands, and you're going to hop up with that left leg. All right, and then bring your crutches up, and the crutches always come in the same motion as your leg that had the surgery.
Okay.
Remember your non-weight bearing. Okay, now as we're coming down, you're going to bring your crutches and your weaker leg down together. Nice job.
Thank you.